the big worry in the country currently is the black fungus. This is a fungus that is rapidly spreading in patients who have contracted COVID-19 or even in patients who are recovering from the disease. Now, why is black fungus spreading so widely in India? Remember, there have been over 7,000 cases, over 120 deaths that have been reported as a result of the black fungus. What we're also understanding is that there is a shortage and an unavailability of the drug amphotericin, which is used to treat black fungus. The latest information that we have is that the government of India has decided to ramp up production of amphotericin. 5 more firms have now been granted a license from the earlier 5. So there is a plan to domestically ramp up production to 5.7 lakh vials in the month of June. But why is the black fungus infection spreading so rapidly here in India? Let's try and understand what this means. What are the signs that one needs to watch out for? Dr. Radhika Banka, consultant respiratory physician, joining us from the Hinduja Hospital. We have Dr. Rajneesh Kapoor with us, the Vice Chairman, Interventional Cardiology at the Medanta Hospital. We also have Dr. Amit Khosla, Senior Consultant Ophthalmology from the Sri Gangaram Hospital. Thank you all very much for joining us this morning. Dr. Radhika, if I can begin by asking you, why is it that we are seeing this rapid spread of the black fungus infection, particularly here in India? One hasn't seen this trend anywhere else in the world.
Yeah, that's a really good question. I think there are a couple of factors. So I think the first, all of us have been talking about the injudicious use of steroids that have happened in the pandemic in India specifically. You know, we know that most of COVID infections, whoever needs steroid will respond with like 7 to 10 days of steroids. But we've seen prescriptions where, steroids have been given for over a month or so in very high doses. So that's, I guess, one of the most important factors why we're seeing quite a lot of mucor or the black fungus. And secondly, again, diabetes is quite endemic in India itself.
Right.
With steroids, complementary to that is uncontrolled sugars, which again acts as a very important growth factor for mucor. But having said all of this, people did receive steroids in high doses even before COVID for other various conditions, but we never saw this kind of an endemic with or an epidemic with mucor. So whether the COVID itself has something to do with, modulating our immune system, which makes us more susceptible for this infection, is something that, is an area of research in itself. And especially with this new variant that we know, the B1617 or the Indian variant as it's called, whether that has something to do with increasing our susceptibility to mucor is something we need to look into.
Right. That's an interesting point that you raise, and let me bring in Dr. Rajneesh Kapoor into the conversation here. Dr. Kapoor, is it true that the cases of black fungus are only seen in those who have diabetes or are immunocompromised? Because we are now getting in reports and stories of even younger people as young as the age of 13 contracting the black fungus.
Yeah. So, yes. So, usually, these spores are available in the soil and other parts. But then in immunocompromised patients, whenever these spores get into the body by inhaled mechanism, so in immunocompromised, they start flourishing in the body and then they cause the infection. But diabetes is one area where it's quite prevalent. It can attack, it can get into the body and cause the disease. Now, steroids is one area where it leads to immunocompromised state in the COVID patients. And COVID infection itself causes immunocompromised state. So, yes, it is more prevalently seen in patients who are immunocompromised or where immunity is down because of COVID, diabetes or steroid use. Then it attacks the body and multiplies it very fast and cause the disease in nasal sinuses, in eyes, or it can also enter into the brains, causing, cerebro-nasal kind of mucormycosis, where it can damage the tissues very rapidly.
All right. I also want to ask you, Dr. Khosla, if I can bring you into the conversation here. How does it spread? Is it contagious? Can one patient who's suffering from black fungus pass it on to another healthy individual or to another COVID patient? Is it airborne like we know COVID is? How does it spread?
So basically, mucor is not infectious. It is a normal fungus lying in the nose, and something has happened which it helped enter the body. So basically, mucormycosis is a sinus disease. It enters through the sinuses. In India, because of the pollution, majority of us have an unhealthy sinus. We are unable to empty out all the dust particles from. Something is happening in the immunity. The last case I treated before this epidemic was a child with dengue who had a cytokine storm. So the cytokine storm, the ferritin high levels change the iron metabolism somehow, and they help the mucor to grow. So this patient which I treated 2 years back, a child with dengue hemorrhagic fever, recovered, and she came back 2 months back to me with full vision. So the main thing is there's some cytokine storm which is creating the problem, and the sinuses are unhealthy. The ferritin is going up. You are using steroids. You are diabetic. So that is the reason why we are having more mucor. One, that it was really, yeah.
Right. It's interesting. You're essentially saying that there perhaps could be some kind of a correlation between exposure to high levels of air pollution and the rapidity with which black fungus is spreading?
No, I'm just saying we have an unhealthy sinus. Everybody high polluted, you have 2 or 3 episodes of sinus. So the clearing mechanism in the sinus of the dust particles is affected. So I have seen 2 cases of the other fungus also getting infected in this epidemic because of high steroid. So basically your clearing mechanism in the sinus has to be good. Some metabolic changes are occurring which helps the mucor grow faster than the other fungus. Normally you see the aspergillus in the sinus invading the orbit normally, but in this epidemic you are seeing the other growing. The awareness was limited for mucor. You generally see in a big hospital 5 to 10 patients a year. So the last time my hospital got out a press release that this is coming up. So the awareness came in. This time the cases are 10 times more. We know that steroids are game changer, life saving. So we know we're giving steroids early because if I want to live, I need steroids early to live through. I have known people who steroids started late, didn't survive. So there's a catch-22 situation. If we don't give the steroids,
well, absolutely.
you don't live.
Absolutely. I think what you're saying in terms of this being a catch-22 situation, is correct because these are life-saving steroids that are being given. However, it is the abuse and misuse of the steroids or self-medication of steroids that one really needs to check. Dr. Kapoor, you wanted to come in?
Yeah. So I just want to, point out at this point that, the way we can prevent this is one, injudicious use of steroids, has to be stopped. So it has to be, even if the steroids are being used in COVID patients, it has to be short and crisp. It should not just carry along, and we should not use it beyond 6-7 days. And one more thing. See, we use the tapering mechanism once we use the steroids in COVID patients, and that tapering involves over 7 to 10 days. So I want to point out that if we are using steroids less than 20 days, we can abruptly stop that steroid also. So there is no need to extra use that steroids for 7 to 10 days more. And also one more important point has to be discussed here, that oxygen, the humidified oxygen which is coming through where there is a water, entry into the droplets also, that container has to be really clean. Now, at times we are giving oxygen, but we are not taking care of those containers through which the humidified oxygen is coming. So these are some of the points whereby we can actually mitigate the spread of mucormycosis.
Very important, Dr. Kapoor. What you're saying is that these unhygienically managed oxygen therapy can also lead to the spread of mucormycosis or the black fungus. Dr. Radhika, if I can come back to you, how do patients who are managing COVID at home and they are on, say, oxygen concentrators at home, how can they take the necessary precautions to minimize the risk of the black fungus?
So as Dr. Kapoor said, I think the first and most important thing is very judicious use of steroids. So as long as steroids are not needed, they should be stopped. And as again, it can be abruptly stopped if it's used for less than 18 to 20 days. The second thing, again, a very good point that Dr. Kapoor has raised about, the humidifiers that all these concentrators use need to be cleansed with, sterile or distilled water rather than, tap or filter water. And even the nasal tubing that we use or the cannulas that are used to deliver oxygen should be changed, ever so frequently. So because those again act as harbors of, the mold or the fungi growing and which we eventually inhale. And because your immunity is anyway suppressed, you tend to get a more fulminant reaction. So I guess cleaning of the oxygen, the concentrators, the filters with sterile water, I think is one of the key important measures. And even the ICMR guidelines that have been released, ever so in the last few days, have recommended the same guidelines as well.
Right. A couple of quick questions to understand this better. Dr. Khosla, we know that it's predominantly being found in COVID patients and patients who are recovering from COVID, diabetes patients, those with, who have been given a high level of steroids, life-saving drugs, or an abuse and misuse of steroids as well. The question, therefore, that many are now asking is, can a healthy individual who has not got COVID, not got diabetes, also get the black fungus?
Really, non-COVID patient will have it. As I mentioned to you, that it's a rare fungus overgrowing the area, which is normally present. So it's basically airborne, but every person who gets exposed will not get it. It is the local surface which is not able to stop the mucus growing into the sinuses. Those patients, especially who are immunocompromised, who have steroids, who are diabetic, and in COVID itself, the lymphocytes are going down, so your fighting ability is going down. So all these factors add up to have infection, but a person who is non-COVID is unlikely to get this disease.
Right. Dr. Kapoor, the shortage of amphotericin, are you concerned about it? Are there alternatives to this particular treatment?
Yes, obviously. So one important point about mucormycosis is early detection. If we don't detect it early, it can really be catastrophic and destroy the tissues, the eyes. Patient can lose eyes, or a lot of surgical invasion may be required into the nasal sinuses. So all those things can happen. So early detection is, if the patient is feeling some issues in the face area where they are not having a sensation, or some plaques or some lesions are being visible in that area, that is somewhere the suspicion starts early. Okay. So early start of antifungals, amphotericin-B obviously is the drug, and early start of antifungal where suspicion is there, and then
But how does the shortage of amphotericin that is being reported, impact our fight against the black fungus?
Obviously, now this mucormycosis is highly prevalent because of COVID cases mushrooming so high, and this infection is also growing. So we are not prepared. We are not prepared with the reserves of amphotericin-B in the market. So there is a dearth, there is a scarcity being observed of amphotericin-B in the market. We have to be more prepared with this. There may be requirement. And once that happens, we have seen, the chemists and other stuff, they start hoarding the drug, which makes it further worse. So we have to be more prepared with the supplies coming from the back, and there is no dearth of this amphotericin-B, as this is the main drug which will erase and which will control the infection.
Well, the government has decided to ramp up the production of the drug from 5 manufacturers. There are now going to be 10. There are certain targets of over 5 lakh vials that have been set for the month of June. So one sincerely hopes that we will be able, to manufacture more drugs so that we don't reach a point where there is a shortage and a mad scramble, as we saw for several COVID drugs. But Dr. Radhika, if I can end by asking you, all of you doctors have maintained that precaution is very important, early detection is very important. Talking about precaution, what can individuals do in a household, given the fact that this is prevalent in the soil? Should vegetables be washed in a certain way? Should people not be doing any gardening work? What are some of the minor things that one can implement in their daily lives in order to save themselves from the black fungus?
So I think, gardening with gloves, I think, being protective so that you don't have any abrasions in your hand, through which dirty soil can enter, or even washing your vegetables is, are some ways where you can minimize the exposure to the fungus. What's also important is that people who've recovered from COVID and who have been on steroids or who have diabetes is to look out for signs and symptoms. So it might just start off with symptoms such as redness of eyes or a bit of pain around your eyes or your nose. So just having that awareness to pick up those symptoms is important, because as we know from mucormycosis, the earlier you detect it, the higher the chances of survival. and it's an extremely aggressive disease.
Very quickly, any particular reason why this is a second wave phenomena? Could it be linked with the variant strains of COVID? Because we didn't see anything of this kind in the first wave.
Yeah, absolutely. And we've not seen this with any of the other variants, whether it was the UK variant or the South African variant. So there is definitely a theory that this might be related to this variant, which we anyway know is much more virulent and much more infectious as well. But obviously, there needs to be a lot of research for that to actually find out a correlation between
Well, I think that's really important as well. Is there enough research that is being done at the moment to understand why black fungus is so rampant in the second wave of COVID? We're going to continue to keep a very close watch on all of these developments. Remember, it has been declared an epidemic in India. States and centre have to notify the number of black fungal cases that are being reported. But this conversation's been extremely insightful. Thank you, Doctor, so much for sparing your valuable time this Saturday morning and joining us on NDTV.